There's a growing outcry from women across the country with serious health concerns they say are caused by a popular form of birth control. It's called Essure, a permanent birth control device women can get during a quick doctor's office visit. No hospital or surgery required. The manufacturer estimates about 750,000 women are using Essure, most of them in the United States. KXAN special contributor Leslie Rohde has tonight's in-depth report.
Since Essure was approved by the FDA in 2002, the agency says around 10,000 women have reported health complications after having it implanted. Some women said they've experienced things like severe abdominal pain, chronic fatigue, and migraine headaches. Some lawmakers in Washington want it off the market, and the FDA is now taking a closer look. I met two Austin area women who got Essure and say they haven't been the same since. Being a mom takes a lot of energy, but for 29-year-old Angela Otwell, it's a daily struggle.
I go to the grocery store, and that's about it.
Fatigue?
A ton of fatigue.
She blames that fatigue on the birth control device Essure she had implanted January 2015. She had just delivered her second child and wanted permanent birth control. Angela's last pregnancy had been difficult due to an autoimmune condition she has, but she claims those health challenges cannot compare to the physical and emotional pain she has endured since she got Essure. It started with an ovarian cyst rupturing just 5 months after she had the device implanted.
Ovarian cysts just feel like someone took a very long metal rod that's sharpened at the end and just takes it and skewers through your body 3 times wherever it is.
Doctors insert the small Essure devices into the fallopian tubes through the cervix. Within 3 months, scar tissue grows around the coils, creating a barrier that prevents sperm from reaching the eggs. Felicia Crossland loved the idea that Essure did not require anesthesia and downtime like having her tubes tied would. So she opted for the devices after her second child. In the years since, she says her daily routine has been filled with fatigue, bloating, and severe menstrual pain.
What happens most nights is there's this incredible pain that builds in my pelvis, and it actually works its way down my legs. And I would like to say that it was something as simple as a pinched nerve, but I really don't think it is.
Felicia and Angela are some of the more than 1,400 members of this Facebook page where Texas women discuss complications they've had since getting Essure. Some went to Washington last fall to testify before an FDA panel. After that, the FDA recommended a boxed warning listing reported problems like perforation of the uterus and persistent pain, and a checklist for doctors to discuss with their patients, clarifying the risks and benefits. A bipartisan group of U.S. lawmakers introduced the E-Free Act, hoping to pull Essure off the market. But the manufacturer claims it's still safe.
The data around the safety and efficacy of Essure has been examined within the company, and it's been examined by the FDA, and the data does not support the idea of taking it off the market. Even in the latest statements from the FDA, they stated that for the majority of women, Essure is a good option.
At 35, Felicia says her only option now is a hysterectomy, a complete removal of her uterus, the only way her doctor told her he could take out the birth control device.
What would you like to see happen with Essure?
I would love to see Essure completely removed from the market.
They're all bills from hospital visits, ER visits.
Angela says she struggles to pay medical bills she blames on Essure. She also hopes for a hysterectomy and the energy to be the kind of parent she says her children deserve.
Yay! I dream of taking the kids to Disney World. I just hope I get that opportunity.
Angela and Felicia both admit their local doctors have not definitively linked their health problems to Essure, although the women claim their troubles began or intensified dramatically after it was implanted. The women tell us they don't blame their doctors. They blame the device. Keep in mind, in the clinical trials done before Essure was approved, Less than 4% of women reported long-term problems. Still, some women and lawmakers believe that small percentage should have been enough to keep it from ever hitting the market. Leslie Rohde, KXAN News.
The FDA just finished taking public comment on the proposed boxed warning and patient checklist for Essure on May 3rd. The final decision will come at any time. Bayer, the manufacturer, is gathering more data on the risks and benefits of the birth control device. Look for the FDA's complete recommendations and a list of health problems women have reported, as well as a video statement from Bayer with this story at KXAN.com. And this weekend on our political program, State of Texas in Depth, we take a closer look at what Congress could be doing when it comes to Essure. An on-the-ground perspective from our team in Washington this Sunday morning at 8:30 here on KXAN.